Have you ever considered what you would do if a stroke occurred while you were completely alone? For seniors, this scenario can be particularly frightening. But what if I told you there are effective, straightforward actions you can take right away, even in solitude, to enhance your chances of survival? This video is specifically tailored for those aged 60 and above who may find themselves in this alarming situation. We will explore 5 essential tips that every senior should know to survive a stroke when immediate help is unavailable. No fluff, just straightforward practical advice aimed at empowering you to act swiftly and save your own life. Stay tuned, as what you learn here could genuinely be a lifesaver. I assure you, it's easier to remember than you might think. Let's dive in. Tip number 1. Recognizing the signs and acting promptly. When it comes to surviving a stroke or heart attack, the first crucial step is identifying the warning signs and responding without delay. Time is of the essence because every moment that passes without treatment puts your brain and heart tissue at risk of irreversible damage. Many seniors hesitate or dismiss mild symptoms, thinking they are merely indigestion or fatigue. However, that delay can cost you precious minutes or even hours. Take, for instance, James, a 73-year-old retired teacher who experienced sudden numbness in his face and weakness in one arm while reading his morning paper. Instead of ignoring it, he immediately called emergency services and employed the simple technique we'll discuss next. That swift action made all the difference. He received early treatment and made a remarkable recovery. The importance of recognizing signs early lies in how strokes and heart attacks develop. A stroke may begin with sudden confusion, difficulty speaking, or trouble understanding speech, along with numbness or weakness, particularly on one side of the body. A heart attack often starts with chest discomfort, shortness of breath, cold sweats, or sudden dizziness. Unfortunately, many seniors overlook these signs or feel embarrassed to seek help, fearing they might inconvenience someone or overreact. But here's the reality. Acting quickly saves lives, and it's never a bother to seek immediate assistance. Psychologically, fear and denial can cloud judgment during these critical moments. It's natural to hope symptoms will subside, but that hope can be fatal if it delays calling for emergency services. Learning to trust your body and respond decisively is a form of self-respect and self-care, empowering you to take control even when alone. This mindset shift can dramatically change outcomes. So, the first life-saving tip is to thoroughly educate yourself on the symptoms of stroke and heart attack and mentally prepare to act immediately. Don't ignore your body's signals or worry about causing a fuss. Respond with urgency and confidence. Keep emergency numbers accessible, and if possible, consider wearing a medical alert device that can summon help quickly. This proactive approach is not just about knowledge. It's about adopting a survival mindset, especially crucial for seniors who may face these events alone. Remember, the difference between calling for help at the first sign or waiting can significantly impact the quality and length of your life. Tip number 2. The power of self-help techniques when alone. When you find yourself alone during a stroke or heart attack, the feeling of isolation can be overwhelming. However, it's essential to remember that you are not powerless. There are practical life-saving techniques you can apply immediately to protect your heart and brain while waiting for emergency responders. One of the most vital is the self-administered cough CPR method, which can help maintain blood flow and oxygen circulation, buying you crucial time. Let me share the story of Helen, a 78-year-old grandmother who lived alone and faced a sudden heart attack one afternoon. She recalled hearing about the cough CPR technique during a health seminar and immediately began coughing forcefully every few seconds while dialing 911. Her steady action helped keep her conscious and stable until help arrived. Cough CPR works because coughing forces the heart to pump blood, preventing it from stopping completely, which is especially critical in those first minutes when every heartbeat counts. This technique isn't widely known or taught in everyday medical advice, but for seniors living alone, it can mean the difference between life and death. Additionally, simple breathing exercises designed to increase oxygen intake can further support the body during a crisis. Deep, slow breaths can calm panic and improve oxygen saturation, which is essential when the heart is struggling. Understanding and applying these self-help techniques requires a combination of knowledge and mental preparedness. Many seniors hesitate because they fear doing the wrong thing or worsening their condition. However, the risk of inaction far outweighs the risk of trying. In fact, training yourself mentally and physically to respond with these techniques can build confidence and reduce fear in emergencies. Practicing them regularly, even without a crisis, can help them become second nature. Helen's experience is a powerful example. When her heart began pounding and she felt chest pain, panic could have taken over. Instead, she remained calm and applied what she knew. She kept coughing firmly and evenly, and even managed to reach her phone to call for help. This steady resolve kept her conscious and breathing, providing her body with precious support until paramedics arrived. Therefore, the second life-saving tip is to equip yourself with practical self-help techniques and prepare mentally to use them confidently. It's not about being a medical expert. It's about being proactive and ready to take simple actions that protect your life. This preparation can significantly increase your chances of survival and recovery. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. If you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any videos. Your support helps us continue creating valuable content to inform and inspire you. Now let's move on. Tip number 3. The critical role of recognizing early warning signs. One of the greatest challenges seniors face during a heart attack or stroke when alone is quickly and accurately recognizing the early warning signs. Many ignore subtle symptoms, attributing them to age or other chronic conditions. However, this delay can be fatal. Knowing what to look for and trusting your instincts can be the difference between immediate action and tragic delay. Let me tell you about Carl, a 75-year-old retired teacher who felt mild but unusual discomfort in his chest one quiet morning. Instead of brushing it off, Carl remembered the importance of listening to his body and decided to act quickly. Early warning signs of a heart attack often include chest pressure, shortness of breath, sudden weakness, cold sweat, or nausea. Strokes might begin with sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, difficulty speaking, or severe headache. These symptoms might be fleeting or mild initially, but ignoring them is dangerous. Carl felt mild chest tightness and a bit of dizziness, but he didn't panic. He immediately sat down, focused on steady breathing, and reached for his phone to call emergency services. Recognizing these signs isn't just about physical symptoms. It's also about understanding what's normal for you and what isn't. Many seniors live with chronic ailments that can mask or confuse these warning signals. This is why education and awareness are so vital. Carl's prior education through health workshops and regular conversations with his doctor empowered him to take swift, decisive action when the symptoms appeared. This awareness likely saved his life. Psychologically, understanding early symptoms helps reduce denial and fear, common responses that cause hesitation. When you can name what's happening, you can move from confusion to action. Carl's confidence in recognizing danger allowed him to overcome fear and reach out for help immediately. Despite being alone, this emotional readiness complements physical preparedness and can drastically improve outcomes. It's also crucial to share this knowledge with friends, family, and caregivers. The more people around you who know the signs, the better the chance someone will notice if you can't call for help yourself. Ultimately, the responsibility starts with you. Regular health checkups, discussions with your doctor about your risk factors, and keeping a symptom journal can deepen your understanding of your body's signals. Another aspect of this pillar is the importance of immediate response. Once you notice these warning signs, don't hesitate or second-guess yourself. Call 911 immediately and describe your symptoms clearly. Paramedics can start life-saving treatment on the way to the hospital. Carl did exactly this. He didn't wait for the symptoms to worsen or disappear. He called for help at the first sign, leading to quick intervention and a full recovery. Seniors often worry about being a burden or overreacting, but when it comes to strokes or heart attacks, every minute counts. Carl's story teaches us that taking action early, even if it feels inconvenient or embarrassing, is vital. Your life is worth any temporary discomfort or worry. So, The third life-saving tip is to educate yourself deeply on the early warning signs of stroke and heart attack and to trust those instincts to act fast. This knowledge and confidence are your first line of defense in protecting your life when you are alone. Tip number 4. The life-saving power of the right positioning and breathing techniques. When a heart attack or stroke strikes and you're alone, the way you position your body and control your breathing can dramatically influence your chances of survival. It's not just about waiting for help to arrive. Your immediate actions can ease symptoms, improve oxygen flow, and reduce stress on your heart and brain. This is why knowing how to position yourself properly and use breathing techniques is essential knowledge for every senior. Let me share with you the experience of Helen, a 78-year-old woman who suffered a mild stroke at home while alone. She felt sudden weakness on one side and was scared, but she remembered advice from a community health seminar. Helen sat down, leaned slightly forward, resting her elbows on her knees, and took slow, deliberate breaths. This simple adjustment helped her breathe easier, reduced dizziness, and allowed her to stay calm until paramedics arrived. Proper positioning during a cardiac or stroke emergency can help manage symptoms and prevent complications. For instance, sitting upright or slightly forward can relieve pressure on the lungs and heart, making it easier to breathe and reducing the strain on the heart muscle. Lying flat might worsen symptoms like shortness of breath. If you feel dizzy or lightheaded, try to sit or lie down to prevent falls, but avoid lying flat on your back unless absolutely necessary. Breathing plays a crucial role in maintaining oxygen levels and calming your nervous system. Deep, slow breaths can help reduce panic and lower heart rate, which is vital because panic can increase blood pressure and oxygen demand, worsening the situation. Helen used a technique of inhaling slowly through her nose, holding her breath for a few seconds, and then exhaling gently through pursed lips. This method helped her stay composed and maintain better oxygen intake during her emergency. The psychological benefit of these techniques cannot be overstated. Fear and panic are common during emergencies, and they can lead to poor decisions or physical exhaustion. By focusing on body positioning and controlled breathing, you create a sense of control and calm, which improves your ability to think clearly and act decisively. Seniors who are prepared with this knowledge and practice these techniques regularly are better equipped to face emergencies. Practicing breathing exercises daily can build muscle memory, so in moments of crisis, it becomes second nature. Helen's story is a perfect example of how simple but effective strategies can make a life-saving difference. Additionally, having a phone within reach, ideally with emergency numbers pre-programmed, is essential. Combining proper positioning and breathing with prompt communication can dramatically improve outcomes. Helen was able to call 911 while maintaining calm, which allowed paramedics to arrive quickly and provide treatment. Remember, these strategies are not substitutes for medical care, but crucial first steps to support your body when immediate help is not available. The right posture and breathing techniques buy precious time, reduce complications, and increase the chances of survival. Taking these steps can make all the difference. It's about empowering yourself with practical tools to manage your health even in the toughest moments. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. If you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any videos. Your support helps us continue creating valuable content to inform and inspire you. Now let's move on. Tip number 5. The critical importance of recognizing early warning signs and acting fast. When facing a heart attack or stroke alone, time isn't just money, it's survival. Recognizing early warning signs and acting immediately can be the difference between life and death, and between full recovery or lasting damage. This is especially true for seniors, whose symptoms might sometimes be subtle or mistaken for less serious issues. Let me tell you about Robert, a 72-year-old man who experienced unusual fatigue and mild chest discomfort one morning while he was home alone. Instead of brushing it off, Robert remembered the importance of early recognition and called emergency services right away. Because he acted quickly, doctors were able to administer treatment that minimized heart damage and saved his life. His story illustrates the power of knowing what to look for and not hesitating to seek help. Early warning signs of a heart attack often include chest pain or pressure, shortness of breath, nausea, lightheadedness, and pain radiating to the arms, neck, or jaw. 4 strokes. Common signs are sudden numbness or weakness in the face, arm, or leg, especially on one side, confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, trouble walking, dizziness, and loss of balance or coordination. These symptoms can appear suddenly or develop gradually, but they are always urgent. The challenge is that seniors may sometimes dismiss these symptoms as normal signs of aging or attribute them to less dangerous conditions like indigestion or fatigue. This mindset can be deadly. Recognizing that these symptoms require immediate medical attention can literally save your life or reduce the severity of long-term effects. One reason early recognition is so vital is that treatments like clot-busting drugs or emergency surgery are most effective when administered quickly, often within the first few hours of symptom onset. Every minute counts. Delaying medical care increases the risk of permanent heart or brain damage, disability, or death. Moreover, seniors living alone must have a clear plan to act when symptoms arise. This includes having emergency phone numbers accessible, knowing how to describe symptoms clearly to dispatchers, and even alerting neighbors or friends if possible. Being proactive can speed up response time and improve outcomes. Psychologically, fear and denial often delay action. You might feel embarrassed or reluctant to call for help, thinking the symptoms will pass or that you don't want to trouble anyone. But these feelings can put your health at great risk. Accepting that asking for help is a strength, not a weakness, is crucial for survival. Training yourself and your loved ones to recognize these warning signs can make a significant difference. Educational programs, regular health checkups, and open conversations about symptoms and emergencies empower you to take control when it matters most. Robert's experience serves as a clear reminder. Knowing the signs and responding immediately can protect your health and extend your life. It's not just about avoiding panic. It's about understanding what your body is telling you and acting swiftly. Prepare yourself to act decisively and without delay. This knowledge is your best defense against the unexpected. Final thoughts. Now that we've covered these life-saving tips, it's evident how crucial it is to be prepared, especially when facing a heart attack or stroke alone after 60. None of us wants to envision being in such a vulnerable situation. However, the reality is that it can happen to anyone. That's why knowing what to do immediately, recognizing symptoms, staying calm, calling for help, and utilizing what's around you is not just important. It's essential. You might be thinking, "I'm healthy, I don't need to worry about this," or "I have family around me, so I'll be fine." While that hope is natural, life often presents unexpected challenges. Sometimes help isn't right there when you need it most. Equipping yourself with knowledge and practical steps is the best way to safeguard your independence and your life. Please take a moment now to share what you've learned. Leave a comment below telling us which tip resonated most with you and how you plan to use this knowledge in your daily life. Your experiences and thoughts are important to us and help build a supportive community where seniors empower each other. If this video has helped you, please like, subscribe, and share it with others who might benefit. Your support motivates us to continue creating content that informs, uplifts, and inspires. Together, we can face these challenges with courage and confidence. Thank you for joining us today. Stay safe, stay informed, and remember you have the power to protect your life, even in the toughest moments. We look forward to seeing you in the next video.